There are several aspects that have to be considered in facial transplantation. Obviously there's the facial musculature, which is very important, and whether to use the patient's existing facial musculature or transplant the donor's facial musculature is an issue. The facial nerve is the most important aspect of attaining motion in the face again, and one has to be certain as to what aspects of the facial nerve need replacement or repair. And obviously the sensory nerves, in this case the infraorbital nerves, are an important aspect of what's going to need to be repaired. And obviously the vascular supply, usually from the facial trunk. In case number 2, the patient suffered with the plexiform neurofibromatosis that over time led to significant deformity of his face, as can be seen in this animation and as is seen in the text in the print version of the book. For this particular patient, what was required was removal of the lower part of the face in its entirety, as can be seen here. And because all of the facial musculature was involved, this was resected with the specimen. As was the entire facial nerve. What had to be replaced therefore was the soft tissue, musculature, and the neurovascular supply. The various anastomoses are highlighted here and consist of the infraorbital nerves, the facial nerve, and facial artery and vein, as can be seen here. Obviously to reinnervate the muscles that were transplanted with the donor tissue. This is a preoperative video of a patient requiring lower face transplantation, including mandible. This patient is trach dependent and as well is G-tube dependent because of inability to swallow. And transplantation offers the possibility of re-establishing a swallowing mechanism and allowing him to become trach independent. Note how little movement there is in the lower part of the face. Here is his early post-operative appearance, showing good movement in the face. Note that he's no longer trach dependent and he is able to swallow.